So, hey, everybody, afternoon. It's great to see you. I'm Carrie Chapman. I work for a legal aid organization called the Legal Council for Health Justice, and I use she, her pronouns. And we're a small legal aid organization that provides direct services and also does policy and impact work on Medicaid. And I'm here with two of my greatest collaborators and Medicaid champions, Stephanie Altman and Nadeen Israel. So just in closing, what are some advocacy opportunities that we think we can be pushing for to make things even better in Illinois? And Nadeen, I'll let you talk about maybe some room for growth in ex parte.
Awesome. Thanks, Carrie. So this is an area where I'm very passionate about and continue to be, as many of us are. So for us in Illinois, we see an opportunity, and this is an ongoing conversation that's been for a while now, for a number of years with our state Medicaid agency, to ex parte the AABD population. So essentially seniors and folks with disabilities. There is the hurdle that needs to be overcome is the asset test. To be able to kind of comfortably for the state to do that verification electronically and without a touch from the person on Medicaid. But it is doable. There's a way to do it, and we will continue to push the state on this, mainly because it is a large number of folks that would that are negatively impacted by Medicaid redeterminations, especially the procedural terminations, have high healthcare needs. And so a great low-hanging fruit, as they say. So we'll continue to advocate for that one.
For sure. And often folks whose assets don't really change substantially, they're on a fixed income, their assets don't actually change substantially year after year. So Stephanie, what's one thing that we're going to lean into?
Well, I think one of the things we're going to work on a lot is the limited English proficient and immigrant populations. We do a lot of work with our immigrant campaigns, and all of us are a part of those communities and work a lot with assisters who work in different languages. Over 63 languages, I think, are spoken, if not more, by Medicaid recipients in Illinois. Much of the information that we have right now is only in English and Spanish. And although Spanish is one of the top languages, it's quickly, other languages are quickly catching up in Illinois. We do have a direct-to-consumer website called Get Care Illinois, where we've been posting a lot of public information. We have brand new immigrant eligibility, public-facing documents in as many languages as we could afford to translate. And we're seeing that some of those languages are actually replacing others as the top 5 languages in Illinois. So I would say something we're really going to lean into is we're trying to get as much information out to people in other languages. We're really afraid when the demographics come in that we are going to see that immigrants and people who speak languages other than English as their dominant language may be having the hardest time renewing their coverage. Certainly the notices may not make sense to them. People may have not gotten things in their languages, but it's also finding that like one-on-one assistance with someone who speaks your language and sometimes in your area in order to be able to fill that out. One of the stories we just got today is a Spanish-speaking woman who's pregnant, and she actually got a redetermination form during her pregnancy. So a lot of things have changed in her household. She speaks Spanish, and she got the notices and everything in English, and that has happened a lot with us. She really didn't know what to do. She was very worried, especially since she's in a pretty vulnerable situation. And one of our sisters at the Federally Qualified Health Center was able to help her by coming to us, and we found her a Spanish-speaking navigator in her area to fill out her paperwork, because everything she got was sent to her in English. And that's not an isolated situation. So I think that's what we're going to be leaning into more, trying to get as much information out, not just in Spanish, but in all of the top languages, or as many languages as we can afford to get it out in.
Yeah, and I would say also to pressure the state, we don't even have taglines on, in our notices, even for the top, 5 languages after Spanish. So there's a limit to our resources to solve this problem, although obviously we're all leaning into it. And I would say, the last thing is people might be surprised to hear this because Illinois is generally a Medicaid-friendly state, but we have a little bit of a trouble here with transparency and information sharing. And so it can actually be difficult to get timely information out of our state Medicaid agency. And I think there are a host of reasons for that, some of which I'm very empathetic with. But for us to really help people and to turn individual stories into identifying systemic issues, we need to have that data. So another thing that I think we're going to continue to push the state on is just making sure that they're sharing with us what's happening so that we can overlap stories and data and help them see where there's really a problem that's affecting a large number of folks and needs a systemic fix. And Illinois, like every state, right, rejects those systemic fixes. We can fix the one-off, we can fix the one-off, and it's advocates' job to say this is no longer a one-off. You have a systems problem, but we need that data to do it. So we're certainly in the fight with all of you guys in a whole host of states in making sure that we get shine light on this process. So I think that wraps it up for an Illinois update. All three of us are always available to take questions for folks if folks want to know what's happening in Illinois, what things we've done well, and whether they might be workable in your state, or how we're dealing with challenges. If the challenges are similar, then you're welcome to reach out to us. And help will have our contact information. And it was great to talk to everybody. And I'll see you guys on the flip side soon enough. Bye-bye.
Everyone.